take it away.
Good afternoon, and thank you for tuning in today to our media update. And I hope everyone continue to follow the public health recommendations over the weekend and enjoyed a safe Halloween. I certainly, in my neighborhood, saw some great costumes. The Transformers are always the best. They are an incredible amount of work. And everyone was keeping physical distancing, and we were able to put the candies out on the table, and they were able to help themselves, and we still got to enjoy them from afar. So hopefully everyone had a great Halloween, and that all things went safely for you and your family. I'd like to extend my condolences on behalf of the City of Hamilton to the families and loved ones who were killed in Quebec City Saturday night. Horrific attack that took the lives of 2 innocent people and injured 5 others. I wish a full recovery to those who have been injured and would like to commend the first responders who rushed to the scene to ensure community members remain safe. Thank you for all of your efforts as well. Remembrance Day is coming up, as you know, on November the 11th, and a day to remember, honor, and thank every Canadian who sacrificed their future for us. But due to COVID-19, gathering restrictions in accordance with the directions from our Emergency Operations Center will be no public services conducted for Remembrance Day at any of the cenotaphs, including the military parades or public gatherings at the cenotaphs. This is in order to protect our most vulnerable family members or military members and community at large. And so community members are encouraged to watch the virtual service on November the 11th from 10:30 to 11:15 right here on Cable 14 or on the city's YouTube channel at youtube.com/Inside City of Hamilton. You can catch all the remembrance activities there. And of course, the Lancaster will also conduct a flyover of the Hamilton cenotaphs in acknowledgement of the day. Leading up to Remembrance Day, I encourage everyone to continue to wear red poppies in honor of those who gave their lives in service to our country. And on November 11th itself, at 11 a.m., I called on everyone to observe 2 minutes of silence. Many people have shared they have COVID fatigue right now, and let me remind everyone once again that the virus is still in our community. Even though we may be tired of it, it's not tired of us, and it will remain, and we will remain, must remain vigilant in our effort to contain the spread of this virus. So if we don't, we'll be headed into another lockdown or more restrictions, which would be catastrophic not only for our businesses, but also for the lives of those that are contracting the virus. So let's continue to protect our economy and continue to protect our healthcare system by following all the good advice we're getting from our public health officials. Continue to connect with friends and family, however, and if possible, get outside as much as you can. Wash your hands, continue to do the masking, maintain physical distancing, and try and stay within your own family circle as much as you can. That will certainly help prevent the spread. In terms of mental health issues, there is help for you out there. A lot of people may be struggling as a result of the challenges we're facing right now over and above their normal challenges. And so there is help for you. Call COAST. You can call them 24/7 at 905-972-8338 or the Kids Help Phone line at 1-800-668-6868 or by texting HOME to 686868. And you will get through to someone day or night who can help you and get you some care, treatment, or just someone to talk to. And at the same time, let's continue to look out for our friends and family and neighbors, folks that may be single or alone or struggling. Reach out to them and help them as best you can. It's important that we look after one another. I will pass it over to our Emergency Operations Center Director now, Paul Johnson.
Thanks very much, Mr. Mayor. And I just wanted to pick up on something the Mayor commented on around all the things that are happening in a different way for Remembrance Day, and just say that along the way, our Emergency Operations Center has been approached on a number of what are key community events throughout the year. And what we try and do is find ways that it can be done in a safe way without simply canceling things. And I know a lot of people say everything's being canceled. And I would say often that it's being changed a lot. We have virtual runs happening. Marathons are still going on, but they're happening with people doing them on their own and more of that virtual way. Our mom show, just a very successful way of delivering our mom show, and but done in a different way. And so I get it that things are different, but we really feel that there is a balance. And I want to say a special word of thanks, particularly in the case of the Mum Show and our Remembrance Day celebrations and ceremonies, that along the way, our staff have just done a great job of working with our veterans committees and others to make sure that things can be done well. And our Mum Show group, our horticulture team, who are so proud of the Mum Show each year, found a way to do it in a safe way. And by all accounts, it was very well received. So those are the kinds of things that we're looking at. How do we modify? How do we do things in safe ways rather than just saying a flat out no? And that's much of the work that we're doing at the moment, is how are we managing some of these requests coming forward. I did mention last week, I'll mention it again, we are pushing back just a little bit our opening up of adult league, pickup league, shinny type activities in our arenas. We're doing that because our public health officials are meeting not only in Hamilton, obviously Dr. Richardson and her team, but also connecting with some medical officers of health and other public health units that surround us to think about the best way to move these things forward for the next number of months. What we hate doing is starting things, stopping them, because it obviously creates a lot of challenge and in some cases, some anxiety for groups who think they're doing one thing and then we change it. So we'd really like to start things once, do them in the same way and moving forward. And the way we've been handling youth hockey, for instance, has been just that. We set those rules in place very early on. It's been working well, and can't say enough about the clubs that we work with and the way they're handling themselves with our regulations and restrictions. And we're getting kids out on the ice and they're having fun being together, which I think is really important, the developmental side of it, alongside obviously the physical activity of hockey. So these are the ways that we'll be working over the number of months through the winter. I can guarantee it that in every instance, we try and find a way to do things, just do them in a little bit of a different way. So that's very much what we're tackling. The other side from an emergency operations center, as I know Dr. Tran will mention in terms of the local numbers, is we are seeing a number of outbreaks in congregate settings, and the City of Hamilton works in partnership with other municipalities that surround us as part of a command table that also looks at how we can best support congregate settings. This is where the vulnerability is. When you look at the way that this virus has progressed over the last 7 months or so, this is where some of the extreme cases and unfortunately an awful lot of the number of deaths have occurred. So we're very much connected in with our health partners and other partners across municipalities, because we do know that different municipalities, when they run into trouble, may be looking to Hamilton, and vice versa. We may have to look to other communities should anything happen. So a lot of that work is continuing. And I would just remind folks that do have loved ones in care facilities, please follow all of the rules and restrictions that are in place in long-term care facilities and retirement homes and other congregate settings. They're not there to annoy you. They're there to protect your loved one, protect you and your family, and allow some access and visitation. We know that that's crucial, but it needs to be done in a safe way, because you can see that the numbers of outbreaks in these care facilities is starting to increase, and that's something we're watching very carefully and very concerned about. With that, I'll pass things over to Dr. Tran.
Thank you, General Manager Johnson. So in terms of the update numbers of our COVID cases, as of today, we have 1,869 cases in Hamilton, and that's an increase of 43 cases compared to yesterday. And as both Paul as well as the mayor has mentioned, that this number has started to increase. So about a week ago, we had dropped down from closer to 25 down to about 20 cases a day, and now we're back up to 25 cases a day. Of those 1,869 cases, 86% have resolved, and we have 198 active cases, including, I guess, throughout this pandemic, a total of 48 deaths associated with COVID. We have 11 outbreaks that are now on our website, including 3 new outbreaks that have been added today at Shalom Village, Baywoods Place, as well as the Castelli Cucina restaurants. And we declared 1 outbreak over at Wentworth Lodge. So that information can be found on our website, but I think that the key messages that are compared to last week, our numbers have started to increase. And anytime you have cases have numbers that are rising out in the community, unfortunately, it does spill over and get introduced into our congregate setting. So it is really important that all of us do what we can to contain the spread out there in our community. And unfortunately, that also mean reducing the number of visits at this time in the congregate settings as well. I'll give it back to the mayor.
Thank you, Dr. Tran. I appreciate your update. And before we go to media questions, let me just reinforce the message then that I shared last week and that you've heard today. And it's time for all of us to double down our efforts to reduce the spread of COVID-19. Increasing numbers is not a good sign, and therefore, we need to double up our efforts. We must continue to all of that hard work that we've done over the last number of months to get the COVID numbers down and flatten the curve is still very, very important right now. And to ensure that we don't lose all the gains that we've made over the last 4 or 5 months, we don't want to be losing that now. So please keep at the masking, the hand washing, the physical distancing, and minimize the number of gatherings that you're doing. Early on in the pandemic, it was, if you're doing groceries, go alone. Don't go with 2 people. That will minimize contact. It's really all about minimizing contact as much as humanly possible out in our broader community. That will be the best remedy for avoiding a continued spread. With that, I'm going to hand it over to Jasmine for any media questions. Jasmine?
Thank you, Mr. Mayor. So we'll start with one question and one follow-up for each of you. First question goes to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. My first question is for Dr. Tran. The outbreak at Chartwell Willow Grove has increased to 40 cases. Can you talk about, how the virus has spread so fast there and what's being done there?
Thank you, Joanna. It has, spread significantly. I think what we understand is that, it was, as with all outbreaks in congregate settings, it is introduced externally. Somewhere has it in the community, and then someone brings it into the facility. From what we can tell, we can't identify any specific infection prevention and control issues that's happening at the facility. We have done extensive testing to better understand the spread, as well as to implement measures in terms of cohorting and isolating. So we have tested every single person in the facility, including all the residents, as well as all the staff. So those numbers may continue to rise as we wait for the results to get back. We've also done something in addition to see whether we can further, minimize the risk in reducing any introduction, is we've also asked or directed the facility to further limit visitors. I mean, it's not something any of us wants to do, because we understand the benefits of visitation, but now we're only restricting visitors to those who are visiting someone who is gravely ill or palliative. But we are working closely with the facility to continue the measures in place, ensuring we're working with the sector, as Paul has mentioned, to ensure that there's appropriate and adequate staffing in place with our community partners, so that the residents there can still get their care. But we're currently monitoring the situation and ensuring the control measures are put in place.
And thank you very much. My next question is for Paul Johnson. The province has announced a 4-hour daily minimum for long-term care residents. I'm looking to find out, what your reaction to that and what it will take to get Hamilton's 2 homes to that, and how long that might take.
So certainly supportive of the direction. It's been something within the sector that has been pushed for a while. So, and it came out of the commission, one of their early recommendations. And I think there were a lot of questions about whether those those early pieces out would gain some traction within government. And it appears today with the announcement that is going to be part of the budget announcement in the next few days. I was pleased to see the province also acknowledge that it'll take us time to get there. The reality is you increase direct client care with the number of staff in a home, and that is going to take some time. The hiring of more nurses, of PSWs, of the staff within homes cannot just turn around on a dime when you look at how many long-term care facilities exist across the entire province and all the other allied health, or not allied health, the other health facilities that also hire these same number of staff folks. So I think they're looking at this taking a few years to get to that final goal. My expectation is that it will be these incremental steps towards that. I would see that as prudent, but they quickly acknowledge that without the human resources in place to make this happen, you can't just wish more direct care. It requires more staff people on a daily basis. I can attest to that within our own 2 homes here in Hamilton, that we try and provide as much direct care as we can and go above and beyond. But the reality is, with the number of staff that we have and are able to afford to hire at the City of Hamilton, we just wouldn't be able to get there without more people working. And I think that's going to be it's going to be great news for those who we care for. Obviously, those who work in long-term care would love to provide more hours of service every day. And that's why I don't think you'll see an awful lot of pushback in this direction, because those who work in this sector really understand that they want to provide as much direct one-on-one care as possible. That's how we get good, strong results and make life very comfortable for those who call our 2 facilities home. But it will take that hiring, it will take those human resource elements, and that's going to take us a few years to get there.
Great, thank you, Paul. Next question will be to Katrina Clark, also from the Hamilton Spectator. Katrina, you can go ahead.
Thank you. My questions are for Dr. Tran. So the first one, we had, with the 43 new cases today and us hitting 198 for active cases, is 198 our highest yet for active cases? And should the public be concerned about having that many active cases in the city?
Thanks, Katrina. I can't say for sure whether 198 is the highest number we've had, but it's certainly, if it's not, it's certainly up there and close to the highest number of active cases. I mean, certainly I think we should be concerned given not only the number of active cases we have. I mean, I think the good thing is the number of active cases are isolating at home. I think that's one thing to put into context, but the fact that we've gotten 25 cases per day, and that's an increase from 20 cases per day that we saw last week, is something we should be concerned about. I mean, hopefully we can do what we did a couple weeks ago, where we had 25 or more and we brought it back down to 20, and we can do it again as long as we follow the recommendations out there, as the Mayor has mentioned, that we double down on our public health measures. I think we can, get back to being in a better spot. But right now, I think I do want, the citizens to take note and, to take the appropriate actions to bring the numbers back down.
Thank you. And then my second question. So in Toronto today, that city's medical officer of health was pointing to specific gatherings that have led to outbreaks in the city. And she referenced a bachelor party, a cottage getaway, an outdoor barbecue with 40 people. I'm just wondering if there's anything sort of comparable that you can share about where our cases are coming from right now.
Trying to unmute myself. So. Okay. So we don't have any singular large event that we can pinpoint our number of cases coming from. I mean, they are coming from a variety of different situations. Again, having some gatherings, but nothing that particularly large that we can point to driving our numbers. We are still seeing some folks dismissing mild symptoms and thinking that it's not COVID and going to work or attending social gatherings. So I think it is important to stay on a message and stay on public health measures. Again, remind people that if they have symptoms, even if they're very mild, and they think, well, it's probably not COVID, I think it's important to be cautious and stay home. Wait till it all gets better, or get tested. Even better, get tested prior to working or socializing, and ensuring there's hand hygiene, wearing a mask when you're out in public settings, and doing the best in terms of physical distancing and staying within your own household for any close contacts. But no clear few gatherings that we can point to.
Thank you, Dr. Tran. Before we move on to the next reporter, who is our last, I'll just let everybody know that we're going to go through media questions again. So Joanna and Katrina, I'll let you think of another question if you'd like to. For now, we'll move on to Matt from CHCH. So Matt, you can go ahead. And Matt, we probably still have you on mute there. Are you there, Matt? Okay, so well, I'll go back to Joanna, see Joanna, if you have another question you'd like to ask in the meantime.
Yes, thanks so much. I appreciate it. This is for Dr. Tran. So this is the second major outbreak where the Chartwell outbreak is the second one where the facility has done everything right. So in the case of the fitness center outbreak, the province is now sort of looking at its guidelines for fitness centers to see if there's something that needs to change in light of that. Is something similar need to be done for long-term care? If this long-term care home did everything right, does that suggest there needs to be different guidelines or a change in the rule or something done here for that?
Thanks, Joanna. We're looking into this. I mean, right now, we can't pinpoint any clear infection prevention breach. It's difficult to tell whether this is something that occurred by a few, unconscious moments of forgetfulness. But right now, there's nothing that we can pinpoint to. There isn't anything that we would recommend additionally at this point, sort of broader, that we haven't already communicated. So a week or two ago, we have asked the different long-term care homes as well as retirement homes to take further additional measures voluntarily regarding restricting visitors more than what the province is recommending. So that's already been communicated to prevent the introduction of that. We'll look as this outbreak unfolds and as we gain any further information from this one, as well from our provincial counterparts, whether there's any additional learnings that we want to apply to. I mean, the good news is that a number of other outbreaks that we've had in terms of long-term care, retirement homes, have been contained and stopped, and we've declared a number of them over. So I think for the most part, it's working. We just trying to understand this particular situation.
Thanks, Dr. Tran. I'll go next back to Katrina. Katrina, if you have another question, you're welcome to ask it now.
Sure. So my question is again for Dr. Tran. With the recent outbreaks that we're seeing in places like restaurants and shops in the mall and whatnot, most of them seem to be in staff. So I'm wondering if there's more information you can share on what is causing the transmission there, if it's known, like if they're staff members who are socializing after work, or like what is causing that transmission.
So if they're socializing after work and outside of the workplace, I mean, we wouldn't consider that really a workplace transmission. If they're friends and they're doing something, it's where we believe or we have reasonable suspicion that transmission happened within the workplace. It's due to a couple of things that we can see in terms of having closer than 2 meters contact, at times maybe not always wearing the mask, or, on occasion, again, as I mentioned, people discounting symptoms that they don't think are COVID and still coming to work. But then there are certain situations where, we can't pinpoint an exact breach of infection prevention and control. But I think that's, again, the recommendations still apply in terms of what we want people to do.
Great, thank you, Dr. Tran. I'll just try once more for Matt. Matt, if you want to try speaking to us, you can ask your questions. If not, we can follow up with you after. Doesn't look like you're able to get off mute there, Matt. So, Mr. Mayor, I'll pass things back to you for some closing remarks.
Okay, thank you. And thank you to everyone that's tuned in, and thanks for the questions. And hopefully we provided some answers. I want to thank Harmony and the entire team at Cable 14, as well as Clear Cable, that ensures that we have smooth broadcast here as we share this information with you. And the message continues to be from all of us that you continue to adhere to the public health measures we have in place. So if you're sick, stay home, keep your distance from people who don't live with you, wear a mask indoors or when maintaining physical distancing is a challenge, and keep washing your hands and wiping down those touch places that could potentially be a spread of the virus. So more important to do now than ever before, given that our case numbers are up. Let's make it a habit, and hopefully in the near future, we can think about whether or not a virus is on our way. I had someone ask me the other day, how long do you think I'm going to be needing to wear this mask? Someone working in a grocery store. And I think, sadly, I need to tell her that it's very likely that 2021, this is all still going to be very much with us. So it's probably not a bad idea to just get into the habit and maintain that habit as long as you can, to the benefit of us all. Our next media briefing will be on Monday, November the 9th at 4 p.m. We will see you then. In the meantime, stay well, stay safe, look after your friends and neighbors.
Do you have feedback on Cable 14's programs? Let us know by calling 905-523-1414, extension 227, or email feedback@cable14.com.
As we navigate through 2020 and the unique experiences we've all faced this year, it's the connections we have to the community